Good evening, everybody, and welcome to this webinar, which is the introduction to the Masters of Physician Associate Studies at St George's University of London. And we are the UK Specialist Healthcare University. So my name is Lanisha. I'm the Events Officer at St George's, and I'm going to be the host for the event today. So during the course of this event, you'll be able to hear and see all the presenters. However, we won't be able to hear and see you. So the only way you'll be able to communicate with us is through the chat box function, which should be on a panel in your screen. So if you have any questions that you wish to ask from now until the end of this event, then please do send them through in the chat box. We do have staff that are attending to the chat box, so they will be able to respond to your questions throughout the webinar. And any remaining questions that we're unable to answer during the course of this event, we will send an email out to all attendees with the responses to those questions. So the format of this event will be a presentation by the course director, and then you will have the opportunity to hear from two current students, and then we will have a live Q&A at the end to answer any remaining questions that need to be answered, and our panel of staff and students will answer those live on air. If for whatever reason your connection's cut out, please do try and log back in. We will still be here throughout this webinar. And if for whatever reason you're not able to come back in, we will be recording this webinar from now until the end, and all recordings or the recording of this webinar will be sent out to all tomorrow afternoon. So you will be able to get a recording if for whatever reason you're unable to get back in or you have to leave early. Finally, at the end of this webinar, there will be a survey that will pop up on your screens. I'd be very grateful if you could take a few minutes just to fill that out, just to give us some feedback on how you think this event went. Okay, so now we will start with our presentation, from Jeannie, the course director. So Jeannie, if you can come online now, that would be great.
Great, thank you, Lanisha.
Hi, Jeannie, you're welcome.
Thank you. So welcome everyone. It's so lovely to have you online this evening, and it's slightly unfortunate I can't see your faces, but basically my name is Jeannie Watkins, and I am the course director on the Masters in Physician.
Hi Jeannie, sorry, I'm not sure if you can hear me.
I'm going to give a brief overview of the programme, and then valuable is actually hearing from our students and then the question and answer session. So
Jeannie, can you hear me? Sorry, your connection has gone a bit fuzzy.
Yeah. Okay.
So we weren't really able to hear anything that you've said up until this point. So I just wanted to interrupt you for a moment. No, that's okay. Obviously, we have to rely on this technology now to get through these events. So this will definitely happen.
Okay.
You want to talk now for a moment?
Can you hear me now?
You're okay?
Sure. Can you hear me okay now?
Oh, yes, now it sounds fine. I'll take myself away. Here we go.
Okay, so do you want to go on to the first slide, Lanisha? That would be helpful. So I was just saying who I was. I'm Jeannie Watkins. I'm the course director of the Masters in Physician Associate Programme. I am a PA also. I'm trained, obviously, I trained at St George's as one of the first UK trained PAs. So I'm just going to run through briefly the programme, and then I was saying previously, for those who didn't hear me, that actually probably one of the most important, the best things you will hear this evening is actually from our students, and then on the question and answer session at the end. So just to give you an overview of what a physician associate is, so we are healthcare professionals who work in medicine to deliver medical care to patients. So we work in conjunction with doctors, and we work under defined levels of supervision within the medical team. And what that means is we practice medicine, but we obviously have supervision depending on how experienced we are, and different levels of supervision regarding that. Thanks, Lanisha. So in terms of where the profession came from, it was developed by doctors in America in the 60s. And then in 2003 in the UK, we were struggling to recruit and there was a general practice surgery who decided they'd go to America, and they've heard about these physician assistants, as they're known as in America, and we obviously associates here in the UK, and thought it was a really good idea. And then they brought over some US PAs to work in a general practice, and that was incredibly successful. And from that, the profession has grown. Essentially, people saw the to fulfill the gaps in the workforce, and felt that PAs could do that really effectively in terms of providing medical care. Thanks, Anisha.
I do apologise to those in the audience. I think we're having slight technical difficulties again. Jeannie, can you hear me?
I can.
Okay, all right. Sorry, we can hear you again now.
Great. So what do PAs do? Can you hear me now? Oh gosh, sorry about this. So physician associates are trained to take patient history. So if you go as a patient to your GP surgery and you see a healthcare practitioner there, a clinician, you know, they will take a history from you. They'll perform a physical examination. They can formulate differential diagnosis. So they decide what might be going on. They can create treatment and management plans. So decide what you need in order to help with the problem that they've diagnosed. We can absolutely perform procedural skills on patients, and we can propose and recommend medications. So at the moment, physician associates cannot prescribe, and it's a legislative issue rather than a competency issue, because on the programme we cover pharmacology quite a lot in depth. And then obviously we request tests and investigations. We can interpret and diagnose patients from that as well, and we do it all under the supervision of doctors. That means we work in conjunction with the medical team, and we, you know, no one within healthcare really works independently as such. Everyone works within a team, and that's much better for patient care. And as physician associates, that's no different for us. So PAs are absolutely trained to be aware of the limits of competence, and that means that, you know, if you don't know something, you go ask. If you are at the limit of where you can go with a patient, then you'll seek some help. So absolutely trained to work within our competence. Absolutely team players. So as I said before, we absolutely work with the medical team, and lifelong learners. So once you qualify as a PA, that your learning doesn't stop. And as PA, we have to maintain continuing professional development, and we do up to 50 hours per year in professional development in order to keep up to date with the changes across medicine. And PAs are described as dependent clinicians, yet we can make decisions, and that's really describing how we work within the team. And again, as I've said before, no one is independent as such. Everyone works as part of a team, regardless of which healthcare professional group you are. Thank you. So how do PAs work essentially? So I've said it before and I'll keep saying it, we absolutely practice medicine. So we're trained to practice medicine under the supervision of doctors. So we work very closely with the medical team. The working relationship between your PA and your medical team is absolutely based on trust. And you build up that trust over your working relationship and over the time you spend together. But PAs can absolutely work independently or autonomously. So you make autonomous decisions, you see patients, you make decisions, but there are patients that you will have discussions with your team about. And that depends as well whether or not you're working in primary care, so in general practice, or whether you're working in secondary care. Thanks. So in globally, what does the PA profession look like? So in America, the PA profession's been going over 50 years, and there are approximately about 140,000 PAs working across all fields of medicine, and in surgical specialties as well. People working across medicine, I do mean surgical and pediatrics and general practice, so across the breadth of all the different specialities in medicine. In the UK, there are just over 2,000 PAs who are now qualified, and when I certainly trained as a PA, there were a handful of us. So we've made absolutely great leaps and bounds forward as a profession. There are now 2,000. When I initially 9 of us. And there are about 34, 35 programmes across the UK at the moment, and that's across all 4 countries in the UK. So that's Northern Ireland, Scotland, Wales and England. In terms of the Netherlands, there's just over 1,000 PAs, and then they have 5 programmes. And then in Canada, there's around 600 PAs, and as far as I'm aware, there are 5 programmes there. And again, there are lots of different countries who have healthcare clinicians who are called different names, but it's effectively work as physician associates. So in Africa, they call them clinical officers. Australia have very few PAs, and there was 1 programme, and again in New Zealand. In Europe, Germany is growing bigger and bigger, and I don't have numbers for that, but certainly in Europe, the profession is picking up pace and certainly popularity. Thank you. So why PAs in the UK? And really it's about building capacity within the medical team, and certainly building capacity within the NHS to provide care for patients. We have an ageing population. We have a population who are very IT savvy as well, and we've got a population who want to access medical services sort of 24/7, and we have to be able to respond to that in the NHS. So actually having physician associates, it helps with that. It's also about expanding skill mix. So having a PA in your team actually enables to do maybe some of the more complex jobs that they have been trained for, while the PAs can do some of the other jobs that don't necessarily need to be done by a doctor at a very senior level. It also helps with redistribution of the medical workload. And again, that's just what I've described in terms of who's most appropriate to see which patient. And that can be distributed across the medical team. I think the other thing that's really special about PAs is we're taking people who don't currently exist in healthcare and bringing a brand new profession and a brand new workforce. And usually in healthcare, what tends to happen is when people train, then they sort of, someone's recycling people. Well, actually, with the PA profession, we're bringing in new people and a brand new professional group. So we're not depleting the roles that currently exist. Thanks. So in terms of employment in the UK, because obviously if you come to do the programme, you want to know you're going to have a job at the end of it. So as I said previously, there are more than 2,000 PAs trained and qualified in the UK, and they're working across a huge range of specialty areas, and you can see that from the slide. So that's sort of the impact we've had, and also the different areas you might want to work in once you're qualified. So I had a bit of a look on the jobs website for NHS jobs, and I did this on Sunday, so it was the beginning of the week. And there are more than 50 jobs across primary and secondary care advertised at the moment on the NHS jobs website. And again, I've just broken those down as to what was available on the site, but you can see general practice. There are huge amounts of jobs in general practice, and general practice is a really good place to work in terms of you see everything. So you from cradle to grave, you see babies to very elderly people and everything in between. And actually general practice is a really growing area for physician associates to work in. In terms of salaries, also a very important question. PAs are paid on Agenda for Change, which is the national pay scale for everyone who works in the NHS except for doctors. And essentially these are the bandings that PAs may come in on. And most PAs around the London area, around the UK, are paid band 7, but some are in a band 6. And when we talk about preceptorships, the reason they start in a slightly lower grade is because of the support and supervision that are being given through these internships or preceptorships. But you can see there is progression through the bands, and actually as a new graduate, the sort of starting salary is actually pretty good, considering that lots of other professionals who qualify don't start anything like this sort of money. So it's not bad salaries, but you know, working in the NHS, you're not in it for the money. So are there jobs for St George's PA graduates? Absolutely. Our graduates have been amazing. Our students have been amazing. They have set the bar very high. So our graduates tend to be highly sought after, and they have an incredibly good reputation. So there's definitely jobs for St George's graduates. So in terms of the programme, we have a framework for education. It's called the Competence and Curriculum Framework for the Physician Associate or Assistant, because it's currently being updated at the moment. But basically it gives us as programs an outline of the education that we need to deliver over the 2 years of the program. So there is an official document that at the moment is being reviewed, because we are pending regulation with the General Medical Council, and the documentation regarding education and the standards for education is currently under review and will be I think released next year for universities, but it should not change massively from what already exists. Are we having some technical difficulties?
Hi, Jeannie. I do apologise, those in the audience. I think we are having some technical difficulties. Just bear with us for one moment, please.
Okay, so just moving on to the selection process. Okay, so the entry requirements for the programme, you need to have essentially a degree 2 or above in life sciences or health related fields within the last 5 years. We also ask for experience of working with people. We do ask for healthcare experience, but actually if you don't have that, and I know some of the questions maybe around that this evening, it's not essential. It's good to have it, because actually, you know, if you have some experience in working in healthcare, then you'll know this is right for you, because actually applying for this program is financially a commitment, as well as you know, and you want to make sure that your commitment to the program, you want to work in healthcare, so that's useful to have some healthcare experience. But if you don't, experience of working with people will you know, either in, I don't know, in a hairdressers or McDonald's, or you're working with the general public, it's actually very useful. And it's about the transferability of those skills. You need good interpersonal skills and certainly strong English skills, both written and verbal. And the reason for that being, you're going to spend the rest of your career as a PA talking to patients, talking to other healthcare professionals, and documenting your findings from seeing your patients, and other people have to be able to understand and read those. So it's a really important skill. In terms of tuition, at the moment the tuition is £10,500 a year. As I said, it is a massive commitment. And for international students, that's significantly more. There are some grants available. So Health Education England have provided some grants, and certainly for this year that grant is available. I'm not sure for 2021 whether that's available, and we're waiting for them to let us know. And certainly at St George's we do offer some scholarships, and they're worth about £3,000 each. And they are competitive, so you will have to apply for those. But if you are offered a place on the programme, then you can you will be sent the scholarships. Selection this year has changed due mostly to COVID. In terms of application, it is an online application, which hasn't changed. But what has changed is we're using MPAS, which is, I suppose, what people would have used for their undergraduate applications. Our interviews are online, and those have proved very successful for us this year. We've moved to that this year, again, because obviously COVID, and that's how we will move forward when we are selecting for our cohort next year. The 2021 entry application cycle is open, and the closing dates for application are the 15th of January 2021. So just a bit of a rundown about what the programme is about. So essentially it's a 2-year programme. We split it in half into half theory, half clinical placement. And the theoretical elements really are around critical thinking, the psychosocial aspects of medicine. We cover foundations in clinical medicine, so it's about clinical medicine, the application of that. We cover personal and professional development, so within that we do a lot of communication skills and also clinical examination skills. We cover evidence-based practice, so as a clinician it's important that you know where to find evidence and also how to apply it. We have a module that's been incredibly successful, which was quite new to us over the last couple of years, called Investigations in Clinical Medicine. And we brought that module on board as a result of feedback from our students. And I think it's a really good indication of how we listen to students on the programme and how the feedback is important, that it enables us to make good decisions moving forward that will benefit students coming behind. But investigations in clinical medicine are really about things that we do in clinical practice and how we interpret those and how we apply those. And then professionalism is a big thing on the programme. Obviously, you're going to be working in a healthcare arena, and we expect high levels of professionalism, and we assess that on the programme as well. Okay, in terms of, I'm just going to say a little bit about the second year of the programme. It's mostly clinical placements. Then in terms of how we teach and learn, obviously because of COVID, we were a face-to-face programme, very much 9 to 5, Monday to Friday, everyone's in university, with 1 day a week after 6 weeks on the first year of the programme practice. In terms of how we are moving, we're using a blended learning approach, and that means that we are using lectures which are online, and those are live or pre-recorded. We also are using online live sessions for problem-based learning and for our communication skills. They've been working incredibly well, and I'll let the students tell you more about that. In terms of any lectures that are pre-recorded, we try and have question and answer sessions following those lectures at some point within that week. So we're very much trying to enable students to learn in a different way. You're still getting all the learning that you need, but it's done just on a different platform. We are using our virtual learning environment, which is Canvas. And we also use Microsoft Teams and another function called Big Blue Button, and those things seem to work very well. We do have some face-to-face 1 day a week at the moment to teach clinical examination skills, because they're incredibly difficult to teach online. And we've been quite proactive in the programme to make sure that our students are getting what they need to be successful. In terms of clinical skills, we do expect role play, and we do a lot of role play in the programme, both in communication skills and CE skills, and we also bring actors and things in as well to give you some really good experience. There is an expectation that you will have self-directed learning, or you will undertake self-directed learning. This is a postgraduate programme, and it's very different if you're coming from undergraduate into postgraduate. We absolutely provide you with the information you need and the structure you need to learn, but the onus is on you to do additional learning. Attendance to all sessions is absolutely mandatory, regardless of your background, essentially. So if you're coming from an allied health background or nursing background, you still have to attend all of the sessions. Okay, and just to give you an idea of the intensity of the programme, this is our schedule for year 1. And really, we go through all of the systems and we teach thematically. So the first couple of weeks is introduction, and then we move into cardiology and cardiovascular, and everything in that block is cardiovascular oriented. So our anatomy and physiology, our pharmacology, our foundations of clinical medicine, your clinical examination skills, so everything is cardiovascular, and then we move to respiratory, and we follow through right to the end of the year. And as you can see, you have very little time off during the programme. So you have 2 weeks at Christmas, 1 week at Easter. And if you're lucky, at the end of the year, you might get 3 or 4 weeks annual leave or leave prior to getting into year 2. But that's only if you have no reset examinations, because the reset examinations will fall during that leave period. Thank you. A bit of an oversight of year 2. And year 2, you spend most of your time in clinical attachment, and then you come back into university for what we call year 2 days. And really it's to do some mopping up of anything that we haven't been able to cover in year 1, but really making sure that you have everything in place that you need in order to move forward, getting prepared for summative examinations at the end of the year and then for the national. And this really gives you an example of the week. And the reason I've put this up, this is our live timetable actually that we ran in September. And just to show you how intense the programme is, and also how we're managing using a colour-coded system to indicate whether a lecture is live, whether a lecture is face-to-face, where you have self-directed learning, where there is an online pre-recorded lecture, where you have a question and answer session. So I think this gives a good overview, one of the intensity of the programme, to the different modalities that we're using that are available to us to make sure that you're doing everything you need to get. Thanks. So a little bit more just about clinical placements. There are core clinical placements that you must complete on the programme, and they are in general practice, acute medicine, emergency medicine, obs and gynae, paediatrics, mental health surgery. We at St George's think care of the elderly, geriatric medicine is incredibly and so we make that mandate for us as a programme. Then you have an elective, and when we say elective, it's not going off to a sunny beach somewhere in the Caribbean and spending some time in hospitals there. It's really about choosing either specialty or specialty you think you might have interest in that you haven't had the opportunity to experience. And we say nearly every specialty, we do have a huge range of electives that you can choose from. In terms of travelling to placement, St George's is your base, and we measure all placements from St George's University of London. We can't impact or affect where you live, and that's your choice to come to St George's. So unfortunately we don't have a travel fund, so there's no way that we can fund travel. And again, for accommodation, if you have to travel to sites that are slightly further away, again that cost would be borne by the student. We do try and make sure that we try and accommodate you where we can within reasonable travelling distance from St George's, and that's up to an hour and 30 minutes max. In terms of how we support our students, I think that's really important for you to know. And we have dedicated faculty. In fact, we have amazing faculty. Most of our faculty are either qualified physician associates or doctors. We have worked together as a faculty very closely for a long time, so we have a really good camaraderie, and I think that's important for you to know as well, what you're signing into and how we function as a team. All our students have personal tutors, and our tutors touch base on a very regular basis and are open for you whenever you need to as well, in addition to some formal meetings. We have a student experience officer. I think we've also demonstrated, certainly when I spoke earlier, that we absolutely do listen and act on student feedback. And again, you can ask our students that question, and I'm hoping that that's the experience they've had from us. The university itself, we have Study Skills Plus, again for students who are maybe struggling study skills, particularly if you're coming from undergrad. Some people find that transition difficult, and also if you haven't been in from work again, transition can be challenging. So study skills is something that university are very proud of, and something that you have. We have representatives, and we strongly encourage you to liaise with the representatives again. The representative the one that isn't taken on the. Sorry, I think there's some technical difficulties going on there, but just about our course representatives, we really value them. They're quite an important part of our programme, and they also represent the course at our course committee meetings. They represent, the students at the course committee meetings. We do have clear and regular communication with our students, and we have at least monthly catch-ups now, and we do that through Microsoft Teams. And we see the Year 1 students every Friday at the moment, face-to-face as well. We do think we're approachable, and we are quite proactive as staff, trying to think ahead about how we might manage things that maybe haven't quite come up, but things that we're anticipating might. We have a very active student union at St George's, and again, students are heavily encouraged, or strongly encouraged, to get heavily involved. We have a new platform called UniChew, which is student voice, and again, it's a platform where students can share challenges or share successes. And then we have a very strong mental health support and emotional health support through an online platform called Together All. And again, it's got lots of resources for students. So I think as a program, I think we're a nurturing program and nurturing university. I think we support our students extremely well. So just a little bit about PAs nationally. So as I mentioned at the beginning, we are going to be regulated as physician associates. We've been championing this for quite a long time, since 2005 essentially, and we've had now the government say that they are going to regulate us. Our regulator will be the General Medical Council. I'm delighted about this. It means very much that we are here to stay as a profession, but also it gives the public and other professional bodies confidence in physician associates. It will hopefully continue to drive up the standard for education for PAs. So we are delighted about the regulation of the profession. The regulation is pending in autumn 2021, so it is a little down the line, but there's a lot of work going on. I did say earlier about prescribing, and PAs cannot prescribe, but this is being taken forward at the moment by our professional body, which is the Faculty of Physician Associates at the Royal College of Physicians. And just to say, there's a website now actually, and it's really good to have a look at that if you're considering becoming a PA. There's lots of really useful information on that website. In terms of how we support each other as educational institutions, we have a PA Schools Council, and it's all of the institutions around the country come together to share good practice, to share how we're functioning as programs. And then obviously the Medical Council, and the General Medical Council do have some things on their website at the moment about PA, so it's worth going to have a look at that as well. In terms of when you finish the PA programme and successfully qualified from us, until you do the PA national examination, you will not be a truly qualified PA. And the national examination is independent of our programme. Every graduate across the country, regardless of where you've done your PA studies, must sit this exam. It's a two-part exam. It's 200 multiple choice single best answer questions, and then a 14-station OSCE. And certainly on our programme, we prepare our students very well for the national exam, and we have excellent pass rates at the national. You have to pay for that yourselves, and currently the fee is £550 for both parts of the exam. In the written part of the examination, they try to have it more locally, so they have centres around the country, and for our students this year they're able to sit that in London. But for the OSCE, everyone has to travel to Liverpool, so you need to plan ahead in terms of costs for the national exam, both travel and accommodation costs, and then the entrance fee. So why do you want to study at St George's? Why come here? We are the longest continuous running programme, and we are in our 13th year. As I said before, we've dedicated course faculty of PAs and doctors, and we've combined over 100 years in clinical practice and 160 years in PA education between us. It makes us all feel rather old when I look at that, or certainly it makes me feel rather old. Our faculty are all experienced, PAs or doctors, and we've all worked in clinical practice. A lot of our faculty still do work in clinical practice across a huge range of specialties, and it gives us that edge, I think, as a programme in terms of where we work and how we can apply our clinical practice in our education and teaching. And we take examples from our clinical practice, so things that we're telling you are real and live and actually happen on a day-to-day basis. We won an award, and that picture is of Karen Roberts, who was our previous course director. And I think this is a really lovely quote. Actually, this is one of our students who nominated us. It says that each staff member builds a relationship with individual in each cohort, and we actually maximise the support that we can offer, and they do this in addition to the normal job, most working as GPs, consultants and PAs. And not only is there a brilliant mix of personalities and character, they're also very knowledgeable and passionate about the skill that they're teaching. I think that's a really lovely quote. That was from Rosina, who was the student that nominated us for the Teaching Award. So we're very proud of that. We do have a lot of dynamic teaching sessions, and again we use expertise from medical and surgical specialties. So we have guest lecturers come in from the different specialties during the teaching year, and obviously in the specialty that we're teaching. So if it's cardiology, we bring in people who work in cardiology. If it's respiratory, we do the same. So you have a real mixture of people coming in to lecture you who are, as I said before, working in real life settings with real patients. The teaching sessions have been specifically developed for the PA course, so I think we pride ourselves on being quite bespoke. And as I said before, we have a really excellent pass rate for all our previously graduated classes in the national exam. You do get, we have a boot camp when you get into second year of training for secondary care placements, because that's where you spend most of your time. And it's very much hands-on clinical skills, so suturing, minor surgical procedures, cannulation, ECGs, urinary catheterization, and we go on and on. And these pictures are actually of our students as well. We obviously are based in a medical school environment, which gives us access to some really great resources. And at the moment, obviously, our access to site is limited, but where possible, we do our very best to still enable you to have all that you need within this current environment. We do have the largest number of PA alumni of any UK course. That's because we are the longest running programme. We are based in London, which is a great location both to live and work in. And many of our faculty have served a national leadership positions within the PA profession. So I am the past president of the faculty of PAs at the RCP. So in summary, why should you be St George's PA? We provide comprehensive medical training in an incredibly supportive environment. We are dedicated, and we have dedicated and enthusiastic students as well. You're incredibly desirable employees, and we have a very strong reputation for producing excellent quality PAs. You absolutely are going to have an opportunity to pioneer a new health profession, and even though we've had 13 cohorts to date, the PA profession is still incredibly small in number, so there are lots of opportunities for you to be potentially still the first PAs in areas that you're working in, which gives you huge scope for opportunities to really develop practice. And it absolutely is an opportunity to help people by providing high quality healthcare, because that's why we all do. We want to work with patients and we want to provide the best healthcare possible. And apparently these are our happy students. This is one of our cohorts, and they were incredibly happy cohort. I think they may have just finished an exam there. That's why they were very happy. Okay, so really for more information, that's the website for St George's. Applications are now open. I feel like I'm on Strictly Come Dancing, where they go, the vote is now open. You can apply via UCAS, and then the close date is on the 15th of January. Thank you.
Thank you very much for that, Jeannie. And I do thank you to our audience for bearing with us through those slight technical difficulties, but I hope you heard the most of what Jeannie had to say. If by the time we are finished with this webinar, there are still some unanswered questions that you have, please do call the inquiry, send us any emails, and we will get all your questions answered, because we want to make sure that you have all the information you need to apply to us should you wish to choose us for your institution. Okay, so now I'm going to invite on some students, current students, to talk to you a bit about student life as a student at St George's. So first I'll invite on Lewis. Hi, Lewis.
Hello, hope everyone can see and hear me okay.
Perfect. And hi, Gabby. Thank you for joining us. So each student is going to spend about 5 minutes talking to you about their experiences. We'll kick off with Lewis.
So, hello everyone. Yeah, my name's Louis. This is Gabby. We're good friends. We met on the course, so it's lovely to see Gabby after such a long time. So we're both in our second year, and so that means we're now on placement in secondary care, and we can talk a little bit about that later on as well. Um, but I think I first wanted to start off by just saying that even with everything that's going on right now in the world, I think it's still a brilliant time um, to study to be a PA and to start becoming a PA. Kind of off the back of what Jeannie was saying just now, hopefully we're going to be getting regulation coming through very, very soon in the grand scheme of things, which is going to open up a lot of doors for us. And with that, the role of the PA is growing and changing. And as a student right now, being a part of that is really quite special, because I'm currently on placement working with PAs who have been PAs for a long time, and they've been waiting for this, and you can see that they are now excited that this is finally coming. And so we get to sort of come in at a really good time where lots of people have sort of laid the groundwork for us, and people in the medical industry and the healthcare industry are starting to understand more about what PAs are and what we do. But yet it's still, like Jeannie was saying, it's still new. It's still, you might still be the first PA someone has ever met, and you still get to be kind of a part of that kind of pioneering work to bring the PA job into the workforce and into the world, or into the UK. We'll start with UK. So that's something that I get excited about, especially now, kind of seeing it and being on placement, and we'll just see what happens next year when regulation comes through, and go from there. The second thing I should probably acknowledge is kind of COVID and the whole pandemic that we're having to deal with. Gab and I can talk about how great it was to meet people when we first got to the university, but I feel like that would be very mean, because your chances of doing that are going to be a lot more limited than we had, which is a shame, because you will make, still regardless, you will make fantastic friends and connections here that will get you through this course, because what I'll talk about in a minute is how intense it is, and you can't really get away from that. It's a lot. So I guess just to overcome that, when I was applying, there was a lot of kind of chat on message boards, on Facebook groups and things like that, and I'd really encourage people to get as active on those as possible, and to kind of start making those online connections earlier, just because they're a bit harder to make than sort of initial face-to-face ones. And then when you do come to university for your more practical things, you'll just have a great time. So that's why I'm really happy to see Gab at the other end of this camera today. So the course is intense, and you've probably heard this a lot, and I have to agree with Jeannie, it's a lot. And I said that not to scare anyone, but I think anyone who is planning on doing this needs to know that, so that you can be prepared. And I don't mean be prepared in terms of feeling like you need to know everything, because you'll come to terms with very quickly, hopefully, that that's not possible. But just the ability to keep going, I think, is what you want. And so by prepare, I mean prepare yourself in your life, kind of control the things you can control. If there's a lot of things going on, then maybe think about whether this is the right time, or if you can get ready to kind of dedicate the majority of your time towards this, because that's what it will require, then I don't think you'll regret that decision. But you just need to know that that's probably what it's going to involve. And in terms of intensity, it's not as much in terms of knowing everything. That will come, and I'm sure every single one of you that ends up going on this course will probably think at one point that there's just too much and that you can't know it all, because everyone who I know has thought that at some point. I've thought it on multiple occasions, and that's true, because you can't know everything, but you do develop the ability to just keep going. And as long as you keep going, then the staff are wonderful, and your classmates will be your lifelines. And there's also so many support systems in place at St George's that they'll tell you about on your induction week, to help get through those tough times, because they will pass, and it's fine. You might finish a whole block and feel like you didn't know anything, but as long as you keep going, and as long as you're still doing the things you can do and controlling the things you can control, you'll make it, essentially. Like, they've done it in the past, we're doing it now, and we didn't think we were going to, and you just will. So that's plenty from me. I want to reserve some time at the end, because I think answering questions might be a bit more helpful, especially in COVID times. But Gab, did you have anything else to add?
Yeah, I've got a couple bits. Thanks, Lou. I will say as well that the course is super intensive. There is a lot to go through, and certainly in the first few weeks, it's okay to not feel like you know how to revise. I know that we all have to go through these sessions that are how to revise, and you're thinking, I'm on a master's course, I've revised before, I know how to revise. But I found, at least, that in the first month, even 2 months, I was trying to figure out what worked best for me. Lots of people were saying, do you want to work together as part of a group? And that doesn't work for me, because I just chat and I'd rather go through things at my own speed. Just try different things out and see what works best for you. And there is a lot to learn, but at the same time, you'll find that at some point it just clicks. And like Louis said, you don't need to know absolutely everything, because whilst you're a student and whilst you're studying and you're revising for things like OSCEs, you are working on your own. But the reality is, you will never be the sole person to provide for a patient. You're going to be a physician associate. So by that, you will be working under somebody else's supervision. So never feel scared. Always just put out what you think is going on, what you think is the best thing for the patient. But you'll always be part of a team, so you'll always have other people's support with you. That said, you will learn a lot, but I think you'll actually come out and be really proud of yourself to say, oh my God, that was a lot, and I know that now. And you can find yourself explaining it to people who might not understand it, and that will help you as well. So I think that's really important. And to go with that, I think support, is incredible. I mean, I think Louis and me kind of identified ourselves as buddies quite early on. We actually got sat next to each other on the first day. So we just every now and then would have a talk through. And I think part of being a PA is accepting that you have limits, and that's fine. That's fine to have. That's why you're part of a team, is because everyone has different limits and you can help each other out. So I'm really enjoying the course personally. I found the first year quite a lot more difficult than this year, I think. For me, I feel bad for you guys as well, because there's less person-to-person interaction, but don't let that stop you from reaching out to others. You never know, they might really appreciate it. So I think the first year, just keep pushing, learn it, and then in the second year, once you see things in person and see how systems work, it will mean so much more, and you'll remember it a lot as well. So don't panic if in the first few months or so you're not quite getting it. Everyone is there, and St George's has so much support, constantly emailing you. I'm sure you will see it if you are lucky to get in. They have so much support going in so many different forms, so I would definitely recommend it. And yeah, I'd like to open up to any questions if there are any.
Thank you very much, Gabby and Lewis. Please stay on screen. Can I invite Jeannie and anybody else who would like to join us on screen to do so, to answer some questions? We have a lot of questions that have come in with the registration forms and during the course of this webinar. I mean, I can assure you now we won't be able to get through all of them on screen, but we'll do our very best to get through as much as we can. Let's start with, how much people do you take onto the course each year? So what's the cohort size every year?
So 70. So we have 70 full-time students each year.
Perfect. And is there specific support available for mature students, people that might have children?
So I think in terms of the support is there for all students, regardless of your, I suppose, your needs. I think if you've got children and things, then you need to think about how you're going to manage that, because as Gabby and Louis said, it's an intense programme. I would suggest you need to have really good childcare support at home, and friends and family in order to help you. But you know, for mature students, we've had lots of mature students who've come through our programme, have done an amazing job. People we had someone who had a baby in the middle of our programme, was back 3 weeks later. I would recommend doing that, and she was a fantastic student, was able to manage, but you know, she had an excellent network of support at home to do that. So we have all sorts of walks of life of people coming on the programme, and that's what makes our programme really rich, I think, in diversity, are the different range of people that come on. But I think you need to have all your ducks in a row to come on the programme in order for you to be as successful as you can be, to you know, get your finances sorted. If you've got kids and stuff, think about how you're going to function, how that's going to work, what support networks you have in place. If you've got caring responsibilities for older adults, the same thing applies. So you need to get yourself organised, but there is support available at university, but it is a postgraduate programme, and the onus is on you, I suppose, to be able to engage with what we have to offer and get yourselves you know, as supported as possible prior to coming on.
Thank you very much. And just for the audience to know, so the other the new faces you can see on the screen, these are faces from the Physician Associate academic team. So they're going to be on hand to help answer some questions, and they have been the ones that have been responding to you in the chat box, okay? Can you apply for deferred entry onto this course?
Alex, do you want to answer that question?
Yes. So unfortunately, we are not taking any deferrals this year. So our admissions process has slightly changed for the next year. We're no longer accepting deferrals, I'm afraid, and we are no longer doing a part-time stream. So if you're applying to the course, you are applying to be a full-time physician associate student from September 2021 for the next 2 years.
Thank you for that. And whether the course could be studied part-time was also a question that has been ticked off there. So thank you for that, Alex. And somebody else has asked, how soon after finishing the course is the national PA exam?
Tripti, do you want to answer that?
Sorry, I missed. I was reading through the questions. Sorry.
How soon after finishing the course is the national PA exam?
Oh, okay, yes. So the students finish in August. So second year students finish in August, and the first national exam is in September, sometimes October, but usually in September. And then there's a second round in January time as well. So literally 4 weeks later, and you're back in doing your nationals.
Okay. What are you looking for in a personal statement?
Oh, so Alex can take this. Alex is our admissions tutor. Yay.
Sorry, I was busily typing away. So from your personal statement, we, as Jeannie said during her presentation, we are looking for skills that are transferable and can be transferred into becoming a successful PA. So we're looking for work experience, we're looking for teamwork, we're looking for responsibility, initiative thinking, examples of initiative working, if you have any, examples of what you've learnt from your clinical experience, what it meant to you. We're looking at why you want to become a PA or a healthcare professional, what it means to you, looking for some understanding of the structure of it. So sort of how the NHS structures, do you have an understanding of how it works? Some of the problems, I don't want to give you too much. I'll give you the whole answer if I'm not careful. But just some understanding of what's going on in the world at the moment with healthcare. Obviously, there's, you know, the last 8 months have given you lots of juicy content. So that's it in a nutshell.
Thank you very much, Alex. And this question is directed to our students. So what type of working experience did you have prior to applying or prior to your interviews?
Do you want to go first, Luke?
Yeah, I can answer first. I'm a touch atypical because I worked in the NHS for a few years before applying as a healthcare assistant and sort of like a nursing assistant in a few different places. So that was my background, and I think some people have done similar. They've done volunteering, even just like volunteering in like in hospitals, just so that, like, if you can't get anything, just sort of like volunteering to show people where to go. I know people that have done that, and then people have been kind of phlebotomists, taking blood, and then also sort of just helping out in clinics and things like that as well, where you might not be sort of trained to do procedures, but you're at least in a clinical setting, kind of helping, even just taking a patient and getting them weighed, just so that you start to learn how to talk to patients and get used to healthcare environments, that sort of thing. But that's from a kind of off the top of my head of what people have done. What about you, Gab?
For me, I hadn't had pretty much any clinical experience. I only really got a job when I was in my undergraduate degree. I worked as a first aider at weekends for rugby matches, so just basic first aid kind of things. And other than that, I was a student ambassador, so I was one of the people that took you for walks around campus and things. And so the kinds of things that I drew from that, I mean, the first aid skills, they were handy. But from student ambassador, I got to speak to a load of different types of people, change how you communicate with them, grow your confidence in meeting new people and speaking with them appropriately. So yeah, I think you can find transferable skills in what you do. Yeah.
Thank you. And so for those that are trying to apply now, those that might be unable to obtain work experience in healthcare settings, what advice would we give to those potential applicants about work experience?
I mean, I'm happy to take this, just to say that actually, while healthcare experience is useful, it's not a deal breaker to get onto the programme. And what we want, if you have worked with the general public, or if you've spoken to someone, or if you've volunteered at something, it doesn't have to be medically related or healthcare related. Then actually, it's about how you put that on your statement. About, as Alex said, and Gabby and Louis have said as well, about its transferable skills. It's about, you know, can you talk to someone? Can you listen to someone? What have you done that, you know, would enable you to, you know, like I said, if you work in hairdressers, McDonald's, or you're working with the general public, can you manage complaints? Can you calm a situation down? Those are the sorts of things, you know, if you're a carer for someone at home, how you do that, how you interact with other people. So I think, you know, what experiences have you got and how can you apply them? So I don't think, if you don't have healthcare experience, don't panic. But use the experiences that you've had and tell us on your personal statement how those might be applicable to working as a PA.
Okay. I guess two more questions around experience and qualifications to get onto the course. So for someone that's been working in health for a number of years, if their qualification is more than 5 years old, would they still be considered? Alex, go ahead.
Yeah, so we absolutely do take applications with degrees that are over 5 years old. That's not a deal breaker for us. That's fine. If it was a health science or a life science, we'd be looking at what you've been doing in the 5 years since. That it may be that we need you to do an additional essay if you haven't been working in healthcare, but it's judged on a case-by-case basis. But it certainly isn't a deal breaker, and I would encourage you to apply if your degree was over 5 years ago, and even if it wasn't in health sciences. Looking at our previous cohorts of students, some of our best PAs have come from non-health science backgrounds.
So those that are from a non-health science background, what helps them to look more desirable on their application? Is it having that recent work experience or something like that? Or is there something additional that they might need to study?
Yeah, so we've answered this question a lot actually in the questions. So you need to have the equivalent of level 4 physiology, and whether that is an additional course that you've studied prior to applying, or you are taking part in and you have evidence to show that you are what's the word I'm looking for? Oh, sorry, it's been a really long day. That you're currently studying it. If you can put the evidence into your application, then we can see that you're studying it, so you're therefore meeting our entry requirements. So human physiology is part of your entry requirements, but and as well as your undergraduate degree.
Okay.
Makes sense.
And do we take international students onto the course?
We do, yes. Shall I take this one? Yeah, so we do take international students onto the course, and the same applies. So we look at degrees that are 2.2 and above, and we will look at the equivalent for international. So we will convert the international. So if it's American, we will convert the GPA into the UK equivalent, and we will look at that. So it's fine. So we do, and we would again encourage international students to apply.
Perfect.
I was just going to say on the back of that, Lanisha, just that if you're an international student, the only place you can practice with a physician associate qualification right now is in the UK. If it's obtained in the UK, you cannot practice internationally with that qualification anywhere else, only the UK.
Perfect, thank you. Does the course include a dissertation?
Philippa, do you want to take that?
I think I answered that one in the chat as well. No, we don't have a dissertation as part of our programme. So essentially the teaching is all clinical teaching that we give you. There is one of the modules is called evidence-based practice. So it teaches you about the importance of research and how that feeds into your clinical practice, but there's not a dissertation.
Okay.
So Lanisha, just to add to that, sorry, I'm going to just jump in slightly. So we are a top masters program. There is a research masters, which is the MSc, and we are an MPAS. So we are a top masters, not a research-based masters. So there is a distinction, but it's still a masters.
Okay, thank you for that. And do students get any say in the placements that they go to? Like, are they able to choose where they get to go or what areas they can go to?
Tripty? And then maybe Louis and Gabby?
This one I heard. Yeah, so students are given a preference list, and students are asked to label their preference sites from 1 to 6 for GP, and then from we have a huge list, and we have an amazing administrator called Kay who works through this list and tries to work out which students would be best where. And then in second year, students are given the entire list of the different placements that are available, and then students put down what they would like to do. And as Jeannie mentioned, all students need to do a certain number of core placements, so students will be asked which sites would be best for them for those ones, and then students are asked to pick from a list of electives as well, and then Kay then works through a schedule for that.
Amazing, thank you. And are any of the placements paid?
So no, students are not paid to attend placements. I see Louis and Gabby smiling, like that's the dream. That's the dream.
I wish.
No, unfortunately, none of our students are paid on placement.
Okay. As a physician associate, can you specialise?
Yeah, I'm happy to take this. I don't know where we've lost one off the camera. Yep, you absolutely can. So you are taught as generalists, as PAs, but you can move into various different places and specialise. So I've worked in GP and acute medicine. One of our faculty worked in PQ, so paediatrics ICU, or neonatal ICU actually, neonatal intensive care, and she now works in neurology. Thank you. Almost got it wrong. So you can specialise and you can go into your chosen field should you have a particular interest, but I would say that as a generalist you will be re-examined for your national exam as a generalist. So even if you are specialising, you are still expected to have a generalist knowledge when you recertify. Whether that changes under the GMC, we are yet to see, but for now it stands that you are expected to have a generalist knowledge So if you work in elderly care, you still need to know about children's health. If you work in mental health, you still need to know about general practice. So hopefully that answers your question.
Thank you. Can students have part-time or full-time jobs while studying on the course?
Louis
maybe,
and Gabby, you want to take this?
yes.
I think not really. You can try, and I think some people have successfully had some weekend jobs, but you need to put this course first. It's really short, it's really intense. Give it your all. I would say concentrate as much as you can on the course. And it is a 9 to 5 course, I believe, or 9 to 6, 9 to 5, I think, Monday to Friday. It will take up a lot of your time, and you will need to study around that as well. So I would advise against it if you can.
Okay.
Yeah, agreed. It's tough.
Thank you. How many applications do you, or approximately how many applications do you receive each year compared to the number of places that you have?
Yeah, so this question's come up a lot and I have answered it in the chat. So last year we've got approximately 450 applicants for 70 places. So it's fairly competitive.
That is cool.
And that is steadily rising year on year.
Okay. Can you provide any further insight into what a surgical physician associate would do?
This is where we need
I mean,
so there are
it's a pretty niche question, isn't it?
It is a very niche question. We need one of our other faculty, Chaz, does a lot of surgery. I'm happy to give it a shot, and then feel free to bolster me, anyone else, students as well. As a surgical PA, you will be scrubbing in and assisting in theatre, whether that be day cases, but also on more complex cases. So as I said, Chaz, who's our poster boy, who you will have seen in Jeannie's slides, works in neurology at St George's, and he scrubs in and does day cases. He has his own lists as well, so he sort of does investigative investigations as well, so looking into people's bladders, etc. And yes, scrubs in alongside the surgeons. I don't know if you guys, Gabby,
yeah, no, I can help.
Experience, yeah.
Alex, yeah. So in terms of surgical PA, it depends where you work, and depending what the actual service needs will depend on what you do. So actually, I don't think there's any one size fits all for people working in different specialties or in the same specialty, but in different hospitals across the country. And I did a presentation at a surgical conference, so I had lots of examples of people doing very different things in the surgical field. So we, as PAs, as Alex said, we are trained as generalists, and therefore, regardless of where you work, you're still the beauty of you working in a specialty area is you are the general PA. There's someone with the generalist knowledge and skills working in a specialist area. And while you may have specialist knowledge and skills, the benefit of a PA is because you are a generalist. So you're not going to be the specialist in that area per se. I know it sounds a bit contradictory, but that's exactly it. You bring the generalism to that specialty, but you can still provide specialist services. So some PAs, we have PAs been working in orthopedics and trauma at St George's probably for the last 10 years. They are the generalist on that ward. So actually they don't spend a lot of time in theatre at all. Other surgical specialty PAs like Chaz, who Alex was describing, does spend some time in theatre and does do his own list, but he also spends time in the wards. Other surgical PAs will be very specific and will follow patients. They spend a lot of time in outpatients. But I think the benefit of you doing the surgical team is you could be in outpatients, you can be doing the wards, you can be in ED, clerking inpatients, you can be in theatre scrubbing. So you have a range of skills that you can provide to that whole service. I think, does that help?
That sounds good. That sounds good to me. I've got a few more questions down here. Are there any working opportunities in St George's University, in the hospital at St George's once qualified?
Yes, there's a whole myriad of jobs advertised recently. George has employed over 30 PAs across their trust, and there are more jobs coming out. So there's, I think, a fairly unique job in interventional radiology that came out that was hotly contested for, I have to tell you. And they're quite innovative in terms of being an organisation for, you know, in terms of employing PAs and how the PAs work and function. I think they have a very strong team of PAs across the trust who actually spend time together as well. So they organise continuing professional development for each other, and they have a lead PA, I suppose, who then represents the PAs at higher levels within the hospital as well. So there are definitely George's jobs at St George's for St George's graduate PAs. Yes.
Okay. Are there any courses for qualified PAs to progress onto to become a doctor?
So I would say for that question, so I realise I'm butting in and answering loads of questions, I'll shut up in a second. But actually, if you want to be a PA, it's your chosen profession. If you want to be a doctor, amazing. But there are 2 courses available for you to do to be a doctor. One is MBBS, which is the 5-year medical program, and then the other one is JEP, which is the graduate entry program, and it's a 4-year program. If you want to be a doctor, PA is not the stepping stone to do that. We have had PAs who've qualified and worked as a PA for several years and then have decided to go into medicine. They've had to apply that route like anyone else. It's another 4 or 5 years on top of this training. I think we pride ourselves very much in being a profession in our own right, who have the rights and privileges to practice medicine, but not as doctors. And I think we're all very clear about that. So I think you need to be clear in your own head where it is you want to go. And if this is a second choice to being a doctor, then it's probably not the right thing for you.
Okay. Okay, and just a little bit about finance. Can those that have degrees already still apply for is it a £5,000 bursary towards tuition fees or something like that from the government?
The Health Education England £5,000.
Yeah.
Yes, you can. So I assume that means an undergraduate degree. I'm not sure if you're talking about if this were to be your second postgraduate degree. I'm not sure.
Yes,
but
that's what they said. They have a degree and they want to apply for that for this.
Okay. If you have an undergrad, sorry, go ahead, Jeannie.
No, you're okay, Gabby. Finish and then I can supplement.
I was just going to say, if it's an undergraduate degree that you have, yes, you can apply for the Healthcare Education England. I think it just happens. You don't actually apply for it. But I'm not sure what happens if it's postgraduate. Over to you, Jeannie.
Yeah, no worries, Gabby. Thank you. That was really helpful. Just to clarify, if you're coming onto a master's programme, you can apply for a loan to do a master's programme. And I think the loan is up to £10,000. And that's for anybody who's doing a master's programme. So your second master's, I don't know if that's available to you, but for a first master's, it is. In terms of the funding from Health Education England, it's £5,000 over the 2 years. It is available to all students who apply and are successful in getting into a PA programme. It was available this year for 2020. We think it's going to be available for 2021. I think we're pretty certain it will be, but I think we're just waiting for the final nod from Health Education England, but I'm pretty sure that will be available. Moving forward to 2022, I don't know if that will be available. So this is a training grant in that respect, so there's no application for that. It is automatically given. But as automatically given as it is, it may be automatically taken away after next year. So, you know, we Health Education England are budgeting, I suppose, a year in advance. So I will triple check that, but I'm pretty sure it's available for 2021. And then in addition to that, so we have 3 sources of funding, essentially. The master's loan you can apply for, the grant from Health Education England, which is automatic to every student who comes onto the programme, and we think that is available for 2021. And then the competitive scholarship, which you can apply for if you're successful in getting onto the programme, that's worth £3,000. So those are the 3 funding options available.
And how do these potential students apply for these funding options?
Sure, you have to go to the website for the master's loan, so you apply for a loan essentially. I think that's through a bank or the student. There is advice from student services within the university how to do that, but I'm sure if you Google it, it'll come up fairly rapidly about applying for a master's loan. The Health Education England thing comes directly from us as a university, and what we tend to do is take it off the tuition fees. So you don't directly get £5,000. We take it off the tuition, so you're only charged for a lesser amount of tuition. And the competitive scholarship, once you receive your letter saying that you have been successful at interview and we're offering you a place in the course, you will then be sent information about how to apply for the scholarship.
Okay. Somebody asked about the completion ratio for PAs at St George's. I'm not sure if anybody has already answered this in the chat. I don't want to repeat questions that you've answered. Yeah, so what's the completion ratio? I guess that's if you take the full 70 students at the start, is it always 70 students that would successfully complete?
So students, yeah, sorry, Lanisha, I'll take that. So students, we have 70 who start, we don't always have 70 who finish, and that's probably right, actually. I think if you've got 70 who finish, we might question the quality assurance of our programme. We want every student to be successful in the programme, but it's not always possible. The other thing is students take interruption of studies. Some students drop out for financial reasons. Some students have to take time out because of illness or health conditions. But I think we have about a 10% attrition rate, either through failure because people have not met the grade in the programme, or because of sickness, or because of financial reasons. So we're pretty successful in the programme of supporting students through, but there is an attrition rate of about 10%. Okay,
thank you. Okay, I'm just going through the remaining questions in the chat. Quite a lot of these have been answered. You guys have been great responding to the questions. Thank you so much. I'm sure the audience are very happy to have all of these questions answered. Just bear with me one moment while I get your questions up. If somebody applied last year, will that application affect this year's application?
Alex?
Yep, so I did answer this one further up. No, it won't. So we would look at the documents that have been submitted just for this year. So you're submitting through UCAS, so it's a different process this year. But no, we wouldn't consider your application from last year. And I did say, please make sure that you upload all of your documents to UCAS, and also make sure that your reference is up to date and relevant for this year. We wouldn't accept your reference from last year.
Okay. How many times can somebody apply and be interviewed? If they were to fail at the interview stage, how much times could they apply and then be interviewed before they wouldn't be considered anymore?
I might have, so you can, Ginny, I might have to deflect that one to you. You can only apply once per round. Yeah. So if you apply to the application this year and you're unsuccessful this year, you can't reapply. So you'd have to wait until next year's cohort. In terms of how many times you can interview, off the top of my head.
Yeah, go ahead.
Oh no, you go, Ginny, because I
was going to say, I think we had a 2 or 3 times and then you were done. I think we had 2 or 3 attempts and then that was it.
I think that's what it is for the undergraduate courses. I wasn't sure if it was the same for the master's programs as well.
No, it hasn't come up
I think
yet.
so. We can double check that, Lanisha, actually, and get back to you, because it changed slightly. We'll double check that and get back.
Sure. And what's the interview style like for this course?
I'm not sure. So that question came up, and I'm not going to give too much away. We kind of pride ourselves on keeping our interviews quite secret. And there is a sort of a confidentiality that we ask all our applicants to sign before the interview, which I'm sure Gabby and Louis can attest to. So it's now a virtual one, so you will be sent instructions before your interview, and you will record your interview, and then we will mark them virtually. And they'll be running this year from January to March. So the first ones are in late January, and then we run through till March, and there's 4 days.
Okay. Okay.
I'm afraid I'm not giving you more.
That's all. No, we don't have to give away too much. So what can someone do from now up until the application deadline to increase their chances of being considered?
Louis and Gabby, have you got any suggestions for people who want to be considered in the programme? What you would advise them to do?
I'm not sure. Have people submitted applications already, or is it not yet open?
It's open.
It's open now.
It's open. Okay. I mean, if you've submitted, then you've submitted, and very good luck. And I guess then prepare as if you're going to come anyway. So I guess if you've not got any volunteering or any healthcare experience, maybe just try and find some. See if you can go and shadow someone, if there's anyone that you know in healthcare. See if you can go and shadow them for a day and just really get an experience of what it's going to be like. And then if you're perhaps not successful this year, then you can use that going forward to boost your application for next year. And it's just always good to get an idea of where you're going to be going into. And in terms of just preparing for the course, you'll learn everything you need to know on the course. But if you want to brush up over some kind of physiology textbooks, that won't hurt. But I think the main thing is just getting yourself prepared, I guess mentally and sort of organizationally, so that when it comes down to it, then you're ready to go, and kind of focus from there. If you haven't yet handed in your application, I think that'll be more in terms of finding experience, and just really understanding what PAs do, why we're even here, why PAs are vital to the NHS, what makes us different from doctors, nurses, other healthcare professionals, and then sort of demonstrate that you can know that in your application. That would be my best advice, I think.
Thank you very much for that. So we're going to take just 3 more questions, and then we're going to close because we are running over time, but we wanted to try and get through as many as possible since you guys took the time out to join us this evening. So somebody has said that they have gained their degree over 5 years ago, but they're currently a nurse. What else do they need to do? So I guess that would be for them just to continue in their job and apply, right? Yeah.
Yep.
Okay, perfect. We've done tips for personal statement already. Would you consider experiences over 3 years? That was over 3 years ago?
We tend not to. We look at recent experience. There tends to be sort of a 3-year limit on what is classed as recent. So I'd encourage you to make sure you've got some experience within that 3 years limit if you can.
Okay, so I think this is for Shivani. So if your experience is over 3 years, then try and obtain as much as you can from now up until the application deadline, so you can include all that you can in your application.
Yeah,
would someone with a degree in, sorry?
I should say, as Gabby and Louis said, it doesn't, and we've said before, it doesn't necessarily need to be clinical. You are going to struggle probably in the next few months, just with the pandemic. But it is, again, how your experience, how can you use those the skills you learn and transfer them into being a PA.
Okay.
That's what we're looking for.
Perfect. Would someone with a music degree be considered?
Yep, so they need, so they would be considered if it was a bachelor's, but they would need human physiology at a level 4. Okay. And that either needs to happen before they apply or it needs to be in progress.
Okay. I think we've kind of covered this already about workload and being a student. So Demi, I think your question has already been answered. So the last question we're going to take for the night, guys, And let's see who the lucky person's question is. So is it Niromi? Asked, is it usual for PAs to go on to specialise by studying a PhD in the future? So I guess specialising in PhDs, it's two separate things, right?
Tripti?
So there are some PAs, I know for certain in the States, who have gone on to do PhDs, but it is very rare. I mean, in the UK, as Jeannie said, the PA profession itself is just so young. We don't have that many compared to other professions. So in terms of going on later to then do a PhD, I don't know of any in the UK that have done that. There may have been, but don't know of any. But we know that one member of our faculty, who has been a PA for donkey's years, has gone on to do a PhD. But yeah, it is not the norm. There's lots more to be doing before you even get to that point.
Perfect. Thank you so much today.
Lanisha, can I just add?
Sure, Jeannie, yes.
Can I just add to that really, really briefly? Sorry. So there are a few PAs who are doing PhDs at the moment. They tend to be in education, actually. The two PAs I know who have started, or three actually, who've started PhDs are working in academia.
Okay.
So there is a route to that, and I think that's the other thing that is really useful about PAs, the fact that there are lots of avenues open for PAs. And I talked about it a little bit earlier about the opportunities to do something different in the future. So, you know, we will be looking for PAs not just to work clinically, but also in academia. So we need people to come back and teach the next generation of PAs. We also need to start exploring and opening up the world of research for PAs. And certainly PhDs are definitely something that people will work towards. As Tripti said, it is slightly more unusual at the moment because of the I suppose, the youngness of the PA profession, but that will change with time, and it is starting to change. So I think there are opportunities. Thank you.
Perfect. Thank you so much for that, Jeannie. And thank you to our audience for sticking with us here to the end. And I hope you got all the information that you wanted. As I said before, any questions that remain unanswered, we will get an email sent out to you within the next few days or so with the responses to those remaining questions. So please do look out for that. A copy of this video recording will be sent to all who registered for this event. So you will be able to look back on this video from tomorrow afternoon. Thank you again to the course team and to the students for your useful insight into the course and answering all the questions. Yes, and if you do have any remaining questions about entry requirements or anything like that, please do send an email to study@sgul.ac.uk and the inquiries team will respond to your questions. And remember, the application deadline is the 15th of January, so you've still got time to get your applications in. So thank you all again, and we look forward to hopefully receiving your applications. Good night, everybody.
Good night. Thank you. Thanks, everyone.